Clinical efficacy. As any other kind of traditional and complementary medicine, evidence at different level is the main area of concern. DNA microarrays provided useful suggestions about the behavior of human organisms treated with homeopathy medicines. The results reviewed suggested that the action of drugs proceeds through modulation of gene expressions, and the different gene expression profiles showed consistent concentration-dependent inversion of gene expression, which can justify at a molecular level the concept of simile adopted in homeopathy. In animal studies, homeopathic preparations can produce a clear trend of metamorphosis inhibition in amphibians. This was observed by 7 independent researchers from Austria, Germany, Switzerland, and the Netherlands. Informative controlled animal experiments were also done on alloxin-induced diabetes in rats. The results were also reproduced by other workers. At an observation study level, the EPI-3 survey, which is a nationwide cohort study of primary care practice conducted in a representative sample of GPs from across France and their patients between 2007 and 2008. 518 adults and children with ERDI were included, as opposed to conventional treatment group. Patients in the homeopathic treatment group showed significantly lower consumption of antibiotics and antipyretic divided by anti-inflammatory drugs. OR equals 0.54, 95% CI. 0.38 minus 0.76, with similar evolution in related symptoms. OR equals 1.16, 95% CI. 0.64 minus 2.1. By the end of 2024, 297 randomized controlled trials of homeopathy on 158 different medical conditions had been published in peer-reviewed journals. Of these, 172 papers were placebo-controlled and were eligible for detailed review. 42% were positive 73 trials, that is to say, finding that homeopathy was effective. 3% were negative, 5 trials, that is to say, finding that homeopathy was ineffective. 55% were inconclusive, 94 trials. The percentages of positive, negative, and inconclusive results are similar in homeopathy and conventional medicine. Below are some examples of positive, high-quality, randomized controlled trials in homeopathy. Individualized homeopathic treatment for diarrhea in children. A meta-analysis of 3 placebo-controlled randomized trials by Jacobs et al. 2003 showed that homeopathic treatment reduced the duration of diarrhea. P equals 0.008. Individualized homeopathic treatment for ear infections, otitis media, in children. Over the past few decades, encouraging results have been obtained in performed clinical trials supporting the efficacy of homeopathy, as was shown in recent meta-analyses. Recent meta-analysis of randomized controlled trials revealed that although the overall quality of the evidence was low or unclear, preventing decisive conclusions, there is a statistically significant treatment effect of individualized homeopathic treatment that was robust to sensitivity analysis based on reliable evidence. Findings are consistent with subgroup data available in a previous global systematic review of homeopathy RCTs. At a national level, Health Technology Assessment Report was commissioned by the Swiss health authorities to inform decision-making on the further inclusion of homeopathy in the list of services covered by statutory health insurance. The report confirms there is sufficient evidence for the preclinical effectiveness and the clinical efficacy of homeopathy, and for its safety and economy compared with conventional treatment. Contradictory result was found by the Australian National Health and Medical Research Council, NHMRC, a few years later. The Australian Homeopathic Association, AHA, made a formal complaint to the Commonwealth Ombudsman aimed to hold NHMRC accountable for bias and misconduct because the existence of a positive first report was not disclosed to the greater in date public. The 7-year investigation was closed in 2023 inches. The absence of independent expert scientific expertise. Since the NHMRC report on homeopathy has been widely quoted, it is profoundly regrettable that the scientific misconduct case remains unanswered. For more information on clinical researches, CORE-HOM, the Clinical Outcome Research in Homeopathy database, is the most comprehensive and academically rigorous database of its kind in the world, and the only homeopathy database providing information about the quality of the studies it contains. CORE-HOM contains all types of clinical outcome studies, from randomized controlled trials to observational studies. At present, it comprises over 1,200 clinical studies on homeopathy, but this number will change as the database is continually improved and updated with newly published trials.